Astigmatism is like a four-letter word to patients. When they hear they have it, they get very terrified. That big E, you might see it, but it's going to have a smeared effect where it really doesn't come into focus.
I would strongly encourage every patient to choose to fix their astigmatism. There really is no reason not to fix your astigmatism. Wouldn't it be nice to know that your vision is fixed and you don't really need them? You can still wear fashion glasses.
Gary, can you explain for our viewers what is astigmatism and why is it important to consider correcting it with cataract surgery?
Yeah, so astigmatism is like a four-letter word to patients. When they hear they have it or it's in their glasses, they get very terrified, this word astigmatism. And it's really, it's because people don't understand what it is. We know what nearsightedness is, we understand farsightedness, but astigmatism is that other thing that can be in your glasses and your contact lens prescription that really causes blurry vision. And essentially, the cornea is supposed to be like a glass marble. It's supposed to be the same curvature in every meridian or every direction. But if your cornea is steeper in one direction and flatter in another, kind of like a football, it's oblong, then light rays are not going to come in and focus on the retina at the same point. You're going to have multiple points of focus. And let's say you're looking at the eye chart, that big E, you might see it, but it's going to have a smeared effect where it really doesn't come into focus. So when you correct or reduce astigmatism, it's taking that smeared appearance of the big E and making it into a nice crisp letter. And so when we talk about correcting or reducing astigmatism, I kind of prefer the term reducing astigmatism because after any surgery, we can probably find one unit, 1/4 diopter of astigmatism if we really look for it. So I don't want patients to get obsessed about absolute zero astigmatism. Once you get below a 1/2 diopter or a 1/4 diopter, that's really where it becomes negligible. But when we're reducing astigmatism, it's really providing enhanced contrast and enhanced sharpness to the vision. So if a patient has, let's say, low levels of astigmatism, there are a couple of options. My favorite option for patients who have less than 1 unit of astigmatism, 1 diopter, is actually using the femtosecond laser to reduce the astigmatism using arcuate incisions. You say, well, what are arcuate incisions? Well, they're these incisions that actually are meant to help the cornea really reshape itself into that glass marble where everything is perfectly symmetrical. We make these incisions along the steep axis. It allows them to relax, and the cornea sort of reshapes itself. I actually have a formula that I've published that is really geared for lower levels of astigmatism along with Priya Gupta. It's called the Wortz Gupta formula. So we've published good data about patients who have between about a 1/4 diopter and 1 diopter of astigmatism. If they have these arcuate incisions, they're going to have a 1.8 times increased chance of 20/20 vision rather than not correcting the astigmatism. So in my hands, I can really feel comfortable talking to patients about the benefits of laser cataract surgery if they're going to have the astigmatism procedure with the arcs for lower levels of astigmatism. Now, once you get above 1 diopter or 1 unit of astigmatism, now we're kind of talking about medium and higher levels of astigmatism. In my opinion, the arcuate incisions don't work quite as well because they have to be larger, and there's some downsides. So we really want to use a toric lens as soon as it's possible because toric lenses don't reshape the cornea. They actually they rebalance the light. Once it goes through the cornea, it's sort of imbalanced because the astigmatism is changing the focus. But the lens will actually counterbalance that. So imagine having a funhouse mirror, and having another funhouse mirror, and the two together sort of neutralize each other. That's what a toric lens is. And so again, with the laser, we can use the preoperative measurements. All of that data is injected into the computer of the laser, and it will etch a pattern in the capsule of the cataract to show us exactly where we want to or need to implant the lens so that after surgery it's exactly on axis. Because imagine, again, these funhouse mirrors, or if it's off axis a little bit, it's not going to be as effective. So we really want to make sure that we are counterbalancing the corneal astigmatism with a toric lens. And again, toric lenses come in a variety of flavors. So you have the monofocal toric, which again, that's just for one focal point, one distance. But there's also EDOF toric lenses, trifocal toric lenses, and the light adjustable lens also can correct for astigmatism. So that's sort of a primer on what is astigmatism, how do we correct it. So curious to know what your thoughts are.
Yeah, and I can talk about the light adjustable lens as we mentioned about the toric correction with the LAL. I agree with you that it's very important at the time of cataract surgery, if the goal is to get the most focus out of the vision, to consider how to correct the astigmatism. And laser cataract surgery does help a surgeon be able to really fine-tune those results for patients. The light adjustable lens is another way of treating astigmatism, where the toric correction is embedded into the lens afterwards by light adjustments. And so often patients who have astigmatism, they don't reap the benefits of that cataract surgery or the focusing power of the toric correction right off the bat, right after the surgery, because it requires that light adjustment to be able to correct it.
Yeah, and the only thing that I'd like to add is that I would strongly encourage every patient watching this or listening to this to choose to fix their astigmatism. There really is no reason not to fix your astigmatism. And in fact, a toric lens or a femtosecond laser with Wortz incisions, that's perhaps the only thing that we could all say, every patient should get and should benefit from. There's no reason not to, even if you like wearing glasses after, because of course you can fix the astigmatism afterwards with glasses. Some people like how they look in glasses. Even in that situation, what if you break them? What if you lose them? Think about yourself later in life. Wouldn't it be nice to know that your vision is fixed and you don't really need them? You can still wear fashion glasses. We do that all the time. We'll still put glasses on people. So there's really no reason why you should not be correcting astigmatism.
As a cornea specialist, I can think of a few reasons why not to. I mean, there are those cases that have irregular astigmatism, have corneal disease where we cannot.
Healthy eyes.
But yeah, absolutely. For healthy eyes, I absolutely agree with you that if you have healthy eyes and you don't have corneal disease, there is no reason not to correct the astigmatism. And there's so many different ways of doing it, whether it's with the lens implant or arcuate incisions.